Today we are starting Chapter 11, Nursing Care of Patients with Cancer. Cancer is a condition that affects nearly every system of the body, and as nurses, we play a critical role in both the physical care and emotional support of our patients and their families. In this chapter, we'll talk about what cancer is, the different types and stages, and the common treatments such as surgery, chemotherapy, radiation, and immunotherapy. We'll also discuss the side effects patients experience and how we can manage them safely. Most importantly, we will focus on nursing care, the assessments we make, the interventions we provide, and the patient teaching that empowers individuals to take part in their care. I want you to remember, nursing care of cancer patients isn't just about treating the disease. It's about treating the whole person, supporting their comfort, their dignity, and their quality of life. By the end of this lesson, you should feel more confident in recognizing cancer symptoms, supporting treatment, preventing complications, and helping patients and families cope with this difficult diagnosis. Before we dive into cancer, let's take a step back and review the structure and function of a normal cell. Every cell in the body has a plasma membrane, which acts like the boundary or skin of the cell. It controls what enters and leaves. Inside, the nucleus is the control center. This is where the genetic material, DNA, is stored, and where instructions for cell growth and function are given. Surrounding the nucleus is the cytoplasm, a gel-like fluid that holds all the organelles. Each organelle has a specific job. For example, the mitochondria are the powerhouses that produce energy, while the endoplasmic reticulum and Golgi apparatus help build and transport proteins. The cell also has microtubules and microfilaments that act like the skeleton of the cell, giving it structure and helping it move substances around. Understanding these parts of the cell is important because cancer develops when normal cells stop following the rules of cell growth and division. To understand how cancer changes the body, we first need to understand how healthy cells are designed to work." Unquote. Now let's look at the cell cycle, which is the process a normal cell goes through as it grows and divides. Cells don't just divide randomly, there is a very organized sequence. First, the cell makes copies of its organelles, then it duplicates its DNA, so each new cell has the same genetic information. After that, the cell goes through mitosis, which is the actual division process, creating two identical daughter cells. Once division is complete, the cell can do one of two things. It can differentiate into a specialized cell, like a muscle cell or a nerve cell, or it can return to a resting phase until it's needed again. A key point to remember is that normal cells have a built-in checkpoint system. They follow rules that tell them when to grow, when to divide, and when to stop. Cancer happens when these rules are broken. Instead of resting or differentiating, cancer cells keep dividing uncontrollably, ignoring the signals that normally regulate the cycle. Understanding this normal cycle is essential because many cancer treatments, like chemotherapy and radiation, are specifically designed to target cells that are dividing. Now let's talk about some basic cancer concepts. First, we have benign tumors. These are growths that are not cancerous. They can still cause problems depending on their size or location, but they don't spread to other parts of the body. Then we have malignant tumors. These are cancerous. Malignant cells grow out of control, invade nearby tissues, and can spread to other areas of the body. The word neoplasm simply means new growth. It can describe either benign or malignant tumors. Now, let's look at the pathophysiology of cancer, how it develops. Cancer usually starts with a mutation in cellular genes, which means a permanent change in the DNA. That mutation causes the cell to stop behaving normally. This leads to abnormal cell growth. Unlike normal cells, cancer cells don't follow the rules. They don't have a limit on how many times they can divide. Normal cells have a lifespan, but cancer cells can keep dividing endlessly. Another key feature is the lack of contact inhibition. Normally, when cells touch each other, they stop growing. Cancer cells ignore this signal. They keep piling up on top of each other, forming tumors. So, the bottom line is, cancer develops when cells stop listening to the normal control systems of the body and begin to grow and divide without limits. End quote. Now let's review the etiology of cancer, or in other words, where it comes from and how it develops. One of the biggest causes is carcinogen exposure. Carcinogens are substances that damage DNA and increase the risk of cancer. These can include things like tobacco smoke, radiation, or harmful chemicals. When cancer starts, it usually goes through 3 stages. Initiation. This is the very first DNA change or mutation in a cell. Promotion. At this stage, the mutated cells start to multiply. Progression. Finally, the cells become more aggressive, spread, and form tumors. Now let's look at risk factors. There are many things that increase a person's chance of developing cancer. Oncoviruses. Certain viruses, like HPV and hepatitis B and C, can trigger cancer. Radiation from the sun, X-rays, or radiation exposure. Chemicals, such as those in tobacco smoke or workplace toxins. Irritants, chronic irritation or inflammation can lead to changes in cells. Genetics, family history plays a role in certain cancers. Diet, high-fat, low-fiber diets can raise risk. Hormones, imbalances, or long-term hormone exposure can promote growth. Immune factors, a weak immune system can make it harder to detect and destroy abnormal cells. And of course, the older we get, the more time our cells have been exposed to carcinogens and the more likely mutations have built up. So remember, cancer isn't caused by just one thing. It's usually a combination of risks building up over time that leads to uncontrolled cell growth." Unquote. Here we see some cancer statistics that show the most common cancers in men and women, as well as the leading causes of cancer deaths. For men, the most common type is prostate cancer, making up about 20% of new cases. For women, the most common is breast cancer, which makes up about 30% of new cases. But notice something important. The cancers that are most commonly diagnosed are not always the ones that cause the most deaths. For both men and women, lung cancer is the leading cause of cancer-related deaths. Even though prostate cancer and breast cancer are diagnosed more often, lung cancer is more deadly. Other cancers that cause a high number of deaths include colon and rectal cancer, pancreatic cancer, and liver cancer. The big takeaway here is that cancer is not just one disease. It affects different body systems, and the outcomes can vary widely, depending on the type of cancer and how early it's detected. As nurses, understanding these statistics helps us educate patients about screening, prevention, and lifestyle changes that can lower risks and improve early detection. Now let's focus on the most common cancers seen in men and women. For men, the top 3 are prostate cancer, the most common cancer in men, usually diagnosed through screening like PSA blood tests. Lung cancer often linked to smoking, but it can also occur in non-smokers. Colon, or colorectal cancer, which can often be prevented or caught early with regular colonoscopy screenings. For women, the top 3 are breast cancer, the most common cancer in women, with early detection possible through mammograms and self-exams. Lung cancer, again a major cause of illness and death. Colon or colorectal cancer, just like in men, screening plays a huge role in prevention and early diagnosis. The important point here is that while the specific cancers may differ by gender, screening and early detection are critical for all of them. As nurses, part of our role is to educate patients on recommended screenings, risk factors, and lifestyle changes that can lower their chances of developing these cancers. Unquote. One of the most important parts of cancer care is prevention. The first step is early detection. The earlier cancer is found, the better the outcomes. This is why regular screening is so important. Examples include mammograms for breast cancer, Pap tests for cervical cancer, and colonoscopies for colorectal cancer. Some patients may benefit from genetic testing. For example, if there's a strong family history of breast or ovarian cancer, testing can help identify those at higher risk. A healthy lifestyle is another powerful tool. This means not smoking, staying physically active, eating a balanced diet, and maintaining a healthy weight. Certain protective foods can lower risk. Foods rich in folate and a variety of fruits and vegetables provide antioxidants and nutrients that protect cells from damage. And finally, vaccines play a role in prevention too. For example, the HPV vaccine helps prevent cervical and some throat cancers, and the hepatitis B vaccine lowers the risk of liver cancer. So when we think about cancer prevention, it's not just one thing. It's a combination of screening, healthy living, and vaccines that work together to lower risk. When we talk about recognizing cancer early, it helps to remember the word caution. Each letter stands for a warning sign that should never be ignored. C. Change in bowel or bladder habits. For example, new constipation, diarrhea, or blood in the urine or stool. A sore that does not heal. A wound that lingers can be a sign of skin cancer or another underlying problem. Unusual bleeding or discharge. This can include bleeding between periods, after menopause, or unexplained nipple or rectal bleeding. T. Thickening or lump. A new lump in the breast, testicle, or anywhere in the body should be checked right away. Indigestion or difficulty swallowing. Especially if it doesn't go away, it may be a warning of stomach or throat cancer. O. Obvious change in a wart or mole. Look for changes in size, shape, or color. This can be an early sign of skin cancer. Nagging, cough, or hoarseness. If it lasts longer than a few weeks, it could point to lung or throat cancer. So remember, if you or your patients notice any of these warning signs, it's important to get them checked out quickly. Early detection can make all the difference. When it comes to diagnosing cancer, there are several important tools and tests that can be used. The most definitive test is a biopsy. This is when a small piece of tissue is removed and examined under a microscope to confirm whether the cells are cancerous. Other methods help us look inside the body. These include radiological studies like X-rays and CT scans, nuclear imaging procedures, which use radioactive tracers to show how tissues and organs are functioning, ultrasound procedures, which use sound waves to create images, MRI or magnetic resonance imaging, which gives very detailed pictures of soft tissues. We can also use endoscopy, which involves inserting a flexible tube with a camera to directly view areas like the stomach, colon, or lungs. Laboratory tests are another important piece. Blood work may reveal tumor markers or changes in normal cell counts. Finally, cytological studies, like the Pap test, examine cells taken from the body to look for abnormalities. So while a biopsy confirms cancer, these other tools help detect, locate, and stage it. As nurses, it's important to understand these methods so we can prepare patients, answer questions, and provide reassurance during the diagnostic process. Once cancer is diagnosed, the next step is staging. Staging tells us how advanced the cancer is and guides treatment decisions. We use the TNM system. T stands for tumor, how large it is, and whether it has invaded nearby tissue. N stands for nodes, whether cancer has spread to nearby lymph nodes. M stands for metastasis, whether it has spread to distant organs like the lungs, bones, or liver. The higher the numbers assigned to T, N, and M, the more advanced the cancer. This helps providers decide the best treatment plan. Now let's look at the main therapeutic interventions. First is surgery. Surgery is often used if the cancer is localized, meaning it hasn't spread. The goal is to remove as much of the tumor as possible. Next is radiation therapy. Radiation uses high-energy beams to shrink or destroy cancer cells. It may be used before surgery to shrink a tumor, after surgery to kill remaining cells, or on its own for certain cancers. Finally, we have chemotherapy. This uses powerful drugs to target cells that divide quickly. Because cancer cells divide uncontrollably, chemotherapy can kill them, but it also affects normal, fast-growing cells, which leads to side effects like hair loss and nausea. So in summary, staging tells us how far the cancer has gone, and treatment often combines surgery, radiation, and chemotherapy depending on the type and stage. Let's take a closer look at chemotherapy. First, the action. Chemotherapy works by targeting cells that divide quickly. Since cancer cells divide out of control, chemo can slow or stop their growth. But because it can't always tell the difference between cancer cells and normal fast-growing cells, it also affects hair, skin, the digestive tract, and bone marrow. That's why patients often experience side effects like hair loss, nausea, and low blood counts. Next, the routes of administration. Chemotherapy can be given in several ways. The most common is intravenous, or IV infusion, but it can also be taken orally as pills, injected into muscles or under the skin, or delivered directly into a body cavity, such as the bladder or abdomen. Finally, combination chemotherapy. Instead of just one drug, patients often receive 2 or more chemotherapy drugs together. The idea is that using multiple drugs with different actions makes treatment more effective, reduces the chance of resistance, and attacks cancer from different angles. So, in summary, chemotherapy targets rapidly dividing cells, can be given by multiple routes, and often works best when used in combination therapy. Chemotherapy is powerful, but it also affects normal cells. That's why we see so many side effects. One of the most important is bone marrow depression, which happens at the nadir, the point when blood cell counts are at their lowest after treatment. This can lead to leukopenia or low white blood cells, which increases infection risk, thrombocytopenia or low platelets, which increases bleeding risk, anemia or low red blood cells, which causes fatigue and shortness of breath. Another major effect is nausea, vomiting, and diarrhea. These happen because chemo irritates the lining of the stomach and intestines. Stomatitis is also common. This means painful sores in the mouth, which make eating and drinking difficult. Alopecia, or hair loss, is another well-known effect. While it's temporary, it can be very distressing for patients and impact body image. Chemotherapy can also cause reproductive changes. It may reduce fertility or cause menstrual changes in women and decrease sperm production in men. Finally, some chemo drugs cause neurotoxicity. This means nerve damage that can lead to tingling, numbness, or weakness in the hands and feet. As nurses, our role is not only to monitor for these side effects, but also to provide supportive care, education, and reassurance so patients know what to expect and how to cope. Radiation therapy is often used to destroy cancer cells, but it can also affect healthy tissues around the treatment area. That's why patients may experience these common side effects. The first is fatigue. This is one of the most frequent complaints and often gets worse as treatment continues. It's not just being tired, it's an overwhelming lack of energy. Next is nausea, vomiting, and anorexia. Radiation can irritate the stomach or digestive system, making it harder for patients to maintain good nutrition. Mucositis may occur, which means inflammation and soreness of the lining of the mouth and throat. Xerostomia is another common effect, especially when treating head or neck cancers. This means dry mouth caused by damage to the salivary glands. Patients also often develop skin reactions, redness, itching, or peeling in the area being treated. Nurses should think of this almost like a sunburn caused by radiation. Finally, just like chemotherapy, radiation can cause bone marrow depression if large areas of bone are exposed. This puts patients at risk for infection, bleeding, and anemia. So as nurses, we need to carefully monitor for these effects, provide comfort measures, teach skin and mouth care, encourage nutrition and rest, and support patients as they go through treatment. When caring for a patient receiving internal radiation therapy, it's important to remember the three key principles of radiation safety: time, distance, and shielding. Time: the less time you spend near the radiation source, the lower your exposure. Care should be organized so you can complete tasks efficiently without lingering unnecessarily at the bedside. Distance: radiation exposure decreases the farther away you are from the source. Even moving back just a few feet can significantly reduce your exposure. That's why we position ourselves at the greatest safe distance whenever possible. Shielding, protective barriers such as lead aprons or shields, are used to block radiation. These provide an extra layer of safety when close contact is unavoidable. This is especially important for nurses, visitors, and family members. Pregnant staff and visitors should not be assigned to or visit patients with internal radiation therapy. So remember, limit your time, increase your distance, and use shielding to protect yourself while still providing safe and compassionate care for the patient. To help remember the key complications of cancer treatment, think of the word bites. B is for bleeding. This happens because chemotherapy or radiation can lower platelets, making patients more likely to bruise or bleed. I is for infection. With low white blood cells, the immune system is weaker, so even a minor infection can become serious. T is for tiredness. Cancer and its treatments often cause extreme fatigue that doesn't get better with rest. E is for emesis or vomiting. Many treatments irritate the stomach and cause nausea and vomiting. S is for skin changes. Radiation, chemotherapy, and the cancer itself can cause rashes, redness, or sensitivity. So remember, bites, bleeding, infection, tiredness, emesis, and skin changes. These are the main complications to monitor for and report right away. There are many different types of cancer, and they're usually named by the kind of tissue or cell where they begin. Carcinomas start in the skin or the lining of organs, like the lungs, breast, or colon. Sarcomas develop in connective tissue, like bone, muscle, or cartilage. Leukemias are cancers of the blood and bone marrow, causing abnormal white blood cell production. Lymphomas affect the lymphatic system, which helps fight infection. Melanomas begin in the pigment-producing cells of the skin and are often linked to sun exposure. Now, let's talk about metastasis, which means the spread of cancer. Cancer cells can invade blood or lymph vessels and travel through the body. They can also move by mechanical means, for example during surgery or when tumors press into nearby tissue. Once these cells travel, they can lodge in a new location and grow, forming secondary tumors. This is why cancer can spread from one organ, like the breast, to another organ, like the bones or lungs. So the key difference is the type of cancer tells us where it started, and metastasis tells us how far it has spread. When caring for patients with cancer, we often see a variety of nursing diagnoses that guide our care plans. One is ineffective coping. A cancer diagnosis is overwhelming, and patients may struggle emotionally, spiritually, or mentally to deal with the stress. Nurses provide support, resources, and referrals. Acute or chronic pain is another major issue. Pain can come from the tumor itself or from treatments, and managing it is a priority. Patients are also at risk for infection. Because of bone marrow suppression, their immune defenses are low, so infection control is critical. Ineffective protection relates to their weakened state. Patients may be unable to protect themselves from injury or illness. Imbalanced nutrition is common because of nausea, vomiting, anorexia, or difficulty swallowing. Nurses play a key role in encouraging small, nutrient-dense meals and consulting dietitians. There is also the emotional side, grieving for health, independence, or changes in life plans. Social isolation can happen when patients withdraw due to fatigue, immunosuppression, or body image changes. Finally, disturbed body image is very common, especially with changes like alopecia, surgical scars, or weight changes. Nurses provide support, understanding, and resources to help patients adjust. So remember, nursing care goes beyond the physical. We treat the whole person, mind, body, and spirit. Caring for a patient with cancer doesn't just affect the patient, it also has a big impact on the caregiver. Two common nursing diagnoses for caregivers are caregiver role strain. Family members often feel exhausted or overwhelmed by the physical and emotional demands of caring for someone with cancer. Knowledge deficit. Caregivers may not know how to provide safe care at home, such as managing medications, preventing infection, or supporting nutrition. Nurses play a vital role in teaching and supporting them. Now let's talk about survivorship. Many patients live for years after their treatment ends, but survivorship brings its own set of challenges. There are ongoing care needs in three areas: medical, survivors may need follow-up appointments, monitoring for recurrence, and managing long-term effects of treatment. Physical, patients often continue to deal with fatigue, neuropathy, or other lingering side effects. Psychosocial, survivors may struggle with anxiety about recurrence, body image changes, or difficulty returning to normal routines. So as nurses, our care doesn't stop when treatment ends. We support both patients and their caregivers through the entire journey: diagnosis, treatment, and survivorship. Finally, let's talk about hospice care. Hospice is provided when a patient has a life expectancy of 6 months or less, and the focus shifts from curing the illness to providing comfort and quality of life. Hospice can be offered in different settings: inpatient, such as a hospital or hospice facility, or outpatient, most often in the patient's home. An interdisciplinary team provides care. This team may include doctors, nurses, social workers, chaplains, and volunteers. Everyone works together to meet the patient's physical, emotional, and spiritual needs. Family and caregivers are also an important part of hospice care. They receive education, support, and respite services to help them through this difficult time. The main goal of hospice is not to extend life at all costs, but to provide comfort, dignity, and support for both the patient and their loved ones during the end of life journey. Cancer patients can sometimes develop oncological emergencies. These are life threatening complications that require immediate recognition and action. The first is superior vena cava syndrome. A tumor in the chest can block blood flow through the superior vena cava. This causes swelling of the face, neck, and arms and difficulty breathing. It's a medical emergency. Next is spinal cord compression. When a tumor presses on the spinal cord, it can cause back pain, numbness, weakness, or even paralysis. Quick treatment is needed to prevent permanent damage. Hypercalcemia happens when cancer causes calcium to leak from the bones into the blood. Patients may have confusion, nausea, constipation, or heart rhythm changes. If untreated, it can be fatal. Finally, tumor lysis syndrome often happens after chemotherapy, when large numbers of cancer cells die quickly and release their contents into the bloodstream. This can overwhelm the kidneys and lead to electrolyte imbalances, arrhythmias, and kidney failure. As nurses, our role is to recognize the early warning signs of these emergencies, notify the provider immediately, and support life-saving interventions. End quote.